You beautiful boys and girls, most likely your lower back pain is actually more coming from your hip, something I like to call the hip deltoid. So these next three exercises, along with an extra credit one, focusing on your thoracic lumbar fascia, so actually your lower back, will probably do more for your lower back pain and eliminate it faster than anything else you've ever done and keep it that way for a much longer time. So tune into this video, try the exercises because they're a heck of a lot better than popping pain medication, destroying your gut, and just masking the pain. Alright, so position number one is going to look very similar to the normal foam roll position you've done 1,000 times. Now, the disclaimer here is most likely this is not where your lower back pain is coming from. So follow along, continue to do this because I'm going to explain the basic concept and how we change from the basic concept to more of an advanced one. You notice right now that my right leg is turned out and bent. So I went from this position to here. The reason is we want to work on the hip and the butt muscles. Therefore, we need them in the most relaxed position possible. Imagine if I was trying to massage your bicep, for example, and every single time you just contracted it, I couldn't get deep into the tissue. So from here, in this position, this allows me to start focusing on my hip deltoid is what I like to call it, and I'll kind of break each one down as I go along. So this one is more your gluteus maximus and kind of piriformis, so these muscles here. However, this is most likely not where your lower back pain is coming from, which is why this exercise has never helped. What we're going to do now is you're going to drop onto your right elbow. From here, you're going to recognize that it rotates your hips a little bit laterally. Now, you can keep your hand on the floor and continue. This is a great bicep and chest stretch for the left side of your arm. Or you can pick your hand up and you can set it on your knee. But make sure you don't over-rotate because that is going to be a position 3, actually. So from here, position 1, now on my elbow with my hand on my knee, but I'm not over-rotating at the hips because from here, I can start to play around where I can get back into position 1 from here, or I can slowly start to move a little bit more lateral into my hip deltoid area. This is more of the kind of gluteus medius minimus area. I'll show the pictures here, and I can either completely have a dead leg and drag it with me like this, or as long as I keep it a little bit supple and relaxed, I can move it softly. The goal is I don't want to contract everything and close those muscles or shut those doors, as I like to say, into the area that we're trying to work on. Because the thing is the amount that we're sitting during the day behind the car, which is the worst because then we're in our sympathetic nervous system because we're in a death box driving God knows how close to other cars so fast, or we're just sitting at the office always focusing on the computer. Our butt starts to become less supple and gets more tacked down because the hydration of it is poor because we're not moving, and because of that, the fascia and the muscle and all these different tissues start to adhere together. So this is fantastic because this is just like a deep tissue massage going into the area and breaking it back up. So from here, what I'm going to do is I can play around and go a little bit east to west so I can turn myself. Now I don't always have to go up and down, but now I'm going to slowly go into position number 3, which I'm going to set my leg on the ground if I can, and I'm either going to hold the foam roller or go a little bit higher here and start to get almost in the front tip of where my pocket starts. Now this is going to be a little bit more of your TFL, so I'll show this muscle here. The area in which, well, TFL is actually the muscle where your IT band connects, so the IT band is this. Or I'm going to get a little bit more into the camera because I was in yoga yesterday, so my quads are a little bit tight. I can even over-rotate a little bit more and start getting into the area where the rectus femoris, the quadricep muscle that also flexes our hip and extends our knee, it attaches, sorry. So I can show you right here what I'm talking about. It's a bit painful here, so I gotta keep my focus here. And this would be position number 3. So what's nice here is, again, I can work east to west on this area, and I can really smoothly go from position number 1 to 2 into 3. Now, it might take some practice, that's fine. The areas in which are painful, this is where I want to focus on because this is the language that your body is speaking. It's telling you, hey, listen, this is the area that we need to work on. This is where the pain is. So find a way in which you can work on that. If on the ground is too much, get in your bed and do it. I mean, it sounds a bit dramatic, but if the floor is softer, it's going to push softer into the foam roller, which is going to be less painful for you. So hang out in this area 5-10 minutes. Try to kind of find the areas that are a bit more painful than others. You can even go a little bit higher sometimes, a little bit lower, and you just want to find those trigger points and you want to try to relax them. Now, There's a whole bunch of people out there that says the foam rolling doesn't work and it's only going to make things worse and you're just crushing your muscles and whatever. At the end of the day, give it a shot, because if you do something like this and then you get up and you realize your hip feels amazing, well, that's a whole hell of a lot better than taking synthetic medication, which is going to eventually destroy your gut and basically just mask the pain. It's like unplugging the check engine light in your car. It's not fixing the problem at all. So if something like this works, this is a much more organic, natural approach for your body, and it's something your nervous system is going to understand, and it's something you can do whenever you want. So give this a shot. If this helps, then I would say it works. Now let's go into that extra credit exercise, which is actually going to go into the lower back. All right, so now I am actually in the thoracic lumbar fascia. I'll take a picture of it and show it to you what that is right here. I have my right elbow down and I'm going to keep my left hand in the air so you can realize that I'm not over rotated. My body is slightly turned at the moment to the right. What this means is that it's allowing the foam roller to go into the muscles that are lateral, on the right side, lateral to my spine. So from here, I want to slowly start to rotate to a straight position and then towards the left. Now for me, because of my scoliosis, the left side is going to be a little bit more painful for me because that's the direction of my curve. What you want to do is you want to find that area which is maybe a little bit more painful and try to stay there. If you can do it with your hands, not on the floor, that's fantastic. For many people, this is quite painful. So the goal is not to have these chunky movements, but to work on the coordination, be able to go smooth through the area, because that's going to A, help your body understand that you're trying to treat it. B, it's going to work on your coordination. And C, you're going to make sure that you don't miss any of those areas that could be causing the pain, the trigger points, if you will. Now, the thing is what we want to understand is why this exercise is fantastic, because it actually kind of really works on the QL area too, this muscle here. Your spine is kind of like a tree. So if the tree has the roots that go into the ground, and that's where the stability and the strength, if you will, from the tree comes, it's kind of the same thing with your hip muscles, because your hip muscles are going to connect to your sacrum, this thing here, which is the base of your spine. And I always say if the biggest muscles in the body are connecting to the lower spine in the sacrum, which are all your hip muscles, your glutes and your hip flexors, and those guys are completely locked up and tacked down, then how are you supposed to have this mobility in your spine? And when you throw your back out, you actually end up throwing your SI joint out, this thing right here, and it's actually in your hips. It's not necessarily up in your back. So why this thoracic lumbar foam roll in the lower back is fantastic. Make sure you focus on the first 3 exercises also. All right, if you enjoyed that exercise, please subscribe to my channel, number 1. 2, share this video maybe with someone that you know has back pain and is tired of just masking it with pills and injections and doctor appointments. And also check the link below, because I have an online consultation option, which is 100% with me, and also fantastic knee programs, shoulder programs, lower back programs. Everything is possible. It's me and all of it. I'm as authentic as I can be, and I really appreciate you taking the time, and I hope to see you guys next week for my new video. So make sure you also hit that bell so you know when my new video is released.